My name's Christina Carroll, and I'm from Poughkeepsie, New York. I'm interning with Men's Health Network.
Great. So we wanted to talk to you today about your experience at Men's Health Network interning with us. So can you tell us what your experience has been so far, and maybe we can focus first here on this event, which is the second annual Time Out for Veterans Health event, and tell us what you think.
So far, we've had a really great turnout. It seems like the veterans are really, supportive and appreciative, and it was a surprise to me. I mean, I've done a lot of different health fairs with MHN so far, and this has just been like the big culmination of all those things because I got to do the educational table where you just hand out different educational materials and to see what people are interested in and what they don't know about and what they, what you can offer them advice for. And they're also doing the body fat and grip strength that we also do at the health fairs. So it's been a good turnout so far.
That's great. So let's talk about your greater experience at MHN. What have been some of the things that you've taken away or you've really enjoyed about your intern experience so far?
I think so far is you just get to do a lot of different things. Basically, you could just make the internship what you want it to be. If you want to do more government or policy things, there's more than a number of Hill briefings and lectures that you could go to on either side of the spectrum, either on the Republican side or the Democratic side. Because I've gone to different Democratic steering committee meetings with Nancy Pelosi was there, a lot of different people were there, and I also went to a Republican Lawyers Association meeting, so you could get both spectrums. If you want to do more media things, you could get more in contact with those types of informational organizations, and if you want to do more outreach, you could go to the health fairs. So it's basically what you make of it.
So what's been, out of all those, would you say has been the most rewarding experience to date that you would want to share with some future colleagues that may come and intern with us?
I would say I really liked the outreach, actually, and I didn't think that going into the internship. It seemed more like something that wasn't that interesting or that you could do at any other volunteer organization, but you're really meeting people that really, health is a really intimate thing and it's really important to everyone, and you're meeting people that are having problems and they look for you for advice. So, it's really special. And at the same time, when you're doing really intimate, grassroots things like that, you could bring it up to a level where you're going to congressional briefings and you're taking, you're just an intern in an organization, you're taking it a step out of the box where you're actually going out of your comfort zone and with educated professionals.
Right. So when you look at that, one of the things I think would be important for some of your future colleagues to know too is, as you're kind of looking at the experience overall, do you think it's impacted in any way your decision to continue studying what you're going to study, or may it somehow has influenced what you want to do when you get out of school?
Yes, it definitely has. Right now I'm a history major in school, and I also have minors in international studies and anthropology. So a lot of different things that might not concretely relate to anything else, but just doing the different projects with MHN. I really want to do more in health. I'm not sure if it's going to be in the policy aspect or administration, or if it's maybe even teaching health in different ways. But it really has opened my eyes that you could go in so many different career paths. So you could be really versatile with whatever you do in school, really.
Is there one piece of information that you've learned at MHN that you thought, maybe you didn't know ahead of time, or something that just kind of blew you away when you read it or saw it the first time? Whether it's about data, statistics, something about men's health, anything like that?
I'm trying to think, because there's really just been so many things that went, the first couple weeks when I started here, you just read so much of the information just to get used to, what MHN is all about and what they research and what they do. And I think the biggest thing for me that's actually is important right now in the healthcare debates is just men have historically been more likely to be uninsured. And that's something I never really thought about. And from talking to different professional people, they might have said it's probably women and children that are most likely uninsured. So it's really eye-opening to know other the real facts from real concrete data sources, and to see the other perspective of it. So.
Is there a final thought that you would want to share for any potential future interns or folks like yourself thinking about taking an internship or coming to intern with us at Men's Health Network?
I would say that it's so far the greatest opportunity I've really had, because your eyes are just open to so many different things. And it's really, if you're ready to take initiative and do something, at this point in my life, in my educational career and professional development, I'm not really sure where I'm going, but taking that step to just find different avenues that might work for you is really important. And to find an organization where they can be flexible and listen to you and see what you are personally interested and what you'd like to do more of, and they can, work with that and help you, it's really important. So I would suggest it highly.
Well, it's been great having you as a member of the team. Thanks, Christina.